Hello everyone, my name is Shin Jae Kim of Wooridul Spine Hospital. As we age, spinal stenosis occurs, causing the spaces in our spine, such as the back and joints, to narrow. This can be considered a part of the aging process. The disc in the spine degenerates with age, causing the body to develop thicker back muscles in an attempt to stabilize the spine, which can lead to the occurrence of stenosis. Although this is a compensatory change to support the body, it results in pressure on the nerves, causing symptoms like leg numbness, back pain, and other neurological issues, thus becoming a disease. When you have spinal stenosis, various treatments can be tried. The most basic treatments include non-steroidal anti-inflammatory drugs, medications that increase blood flow, or drugs to reduce nerve pain. If these medications do not improve the condition, steroid injections to reduce inflammation and swelling in the nerves can be attempted. In addition to these treatments, manual therapy or other conservative treatments can be tried. Recently, a procedure called nerve remodeling, where a thin tube is inserted into the nerve canal to wash out inflammation throughout the spine, also known as adhesiolysis, is becoming more common. If these treatments are effective and help the patient return to daily life, there is no need to proceed to the next stage of treatment. Maintaining good posture, engaging in walking exercises, and participating in other physical activities can help manage spinal stenosis effectively. The problem, however, arises with those who continue to experience pain despite conservative treatments. In such cases, despite undergoing treatments such as injection therapy or nerve remodeling, symptoms persist, leading people to think, maybe it's the hospital's fault, and seek care at a different hospital where they often receive the same treatments. This scenario occurs quite frequently. However, conservative treatments are quite difficult to administer, and their effectiveness varies greatly between hospitals. It's not that they work for some and not others, but rather that when the stenosis is severe, these treatments are often unable to control the condition, leading to persistent or recurring symptoms. If you understand what spinal stenosis is, we can easily find a solution. Spinal stenosis is like a blockage in an old hose. Something gets stuck and obstructs the passage, which happens in the spinal canal as well. This is not a sudden change. It is a structural problem that develops over a long period as the spine changes. So, if the inflammation-reducing procedures or injections don't solve the problem, the next step is treatment to widen the nerve canal. That's where surgical treatment comes in. Spinal stenosis is primarily characterized by the narrowing of the nerve canal, but many hospitals still tend to resort to surgeries that involve inserting pins and stabilizing the spine. This has led many people to give up on surgical treatments altogether. However, the core issue in spinal stenosis is the compression of the nerves, so if the nerve compression is addressed properly, the neurological symptoms improve much more than expected. Additionally, some patients have spinal instability and require reinforcement between the joints. In such cases, we perform a procedure called spinal ligament reconstruction, and the results are very positive. Recently, a patient of mine visited several hospitals over 6 years and tried conservative treatments without success. They then came to me and decided to undergo surgical treatment. The patient was diagnosed with severe stenosis at the L4, L5 level, which was causing the symptoms. The spinal ligament reconstruction surgery took just 1 to 2 hours, and the patient recovered very quickly. I remember the patient saying, "I don't understand why I suffered for 6 years when this condition could have been fixed in such a short amount of time." Spinal stenosis is a treatable condition. If conservative treatments work, there is no need for surgery, but when these treatments are ineffective, addressing the root cause with surgery is a good treatment option. Spinal stenosis is not a terminal illness. However, when we try different treatments, it is because we do not initially know whether a minor treatment will suffice or if we will need to proceed to more extensive treatments, such as surgery. That's why there are various treatment options. If minor treatments are ineffective, it might be worth considering surgical treatment as an option. Thank you. This was Shin Jae Kim of Wooridul Spine Hospital.